They can't do it.
No, so the woman will just rip.
Only normal delivery
Yeah.
can be done.
Even when she's young. What kind of problems are the girls having when they're so young?
Girls.
Mhm.
Girls.
When they're married young? Is it obstructed labor, infertility? What happens when she
Hormonal
carries a
imbalances
baby?
we found more.
Yeah.
More hormonal imbalances because the periods will be regular periods will be there, and
Yeah.
anovulatory cycles will be there, and during due to the smoking and all these things, liquor and all these things,
Mhm.
the sperm count motility
Lows.
will be
Mhm.
down for these husbands, spouses.
How long does the girl end up getting pregnant as soon as she's married? Is that something that's expected? Is the main point of getting married to produce children? Or is it more a sign of wealth in the Chenchu culture?
They get married, but they wait for a few years. If they won't get children, they will be like living like that only for a few years. Later they will decide. We found some couples. We have tried to get them, taken them to fertility clinics,
Yeah.
and we had a this thing, scanning and all these things for those women. But due to much expenditure will be there. For each couple, we had to spend more time and money also.
Is part of
The
the
hormonal assay will be very costly.
Mhm.
Very costly. It will be thousands of rupees. That was the main barrier.
As part of the work that you do you find you have to do a lot of rudimentary reproductive health education?
So we, during our visits also, we visits only, we are telling those things to people to have a cleanliness and all these things.
In Delhi, I have Dr. Suman Bisht. She's one of my colleagues from CARE. And one of the problems that she was finding in the area where she was working, it was also very rural, was that the men were always angry. There was the expectation to have sons, and daughters were not. She developed a program now that is very popular in CARE, and a lot of other NGOs are using. It's very effective in teaching rural people about chromosomes and how the sex of the baby is assigned. And she devised a system using colored beads.
Nice.
Yeah.
Here the problem is not like that. Whatever sex will be there, they will accept. But the problem of non having child is a problem because this is a primitive tribal group. Their population is very less when compared to other tribals.
The
That is why they are
survival
called
depends.
PTG. You might have seen the PTG, primitive tribal group. There are some few groups of people are there like that in tribal tribes. So Chenchus are one of them. So we want to protect them, their
The population.
population also. So we do advise. Often we advise not to get family planning operations. The government machinery is overacting. They'll be taking these people to their these things, nursing hospitals and get them operated. But we do advise not to get operated because they have to get their progeny will be protected
Right.
much. Due to this prolonged this thing, after this 10 years of our medical care, we found we have the casualties during the birth we have lessened because of hemogram. We did early checking of
Yes.
pregnancy and the maintenance of pregnancy, antenatal care, and we are giving hematinics. So safer delivery also. Suppose we get hypertensive cases, we are referring these cases to the nearest hospital then. So
How's the follow-up with CARE for the women that you refer for gestational diabetes?
gestational diabetes, we are having a this thing glucometer here. We check the blood sugar. Urine sugar also we are having urine sugar testing machine is there.
Is that prevalent at all because of the unbalanced nutrition?
Up to date, even today,
Yeah.
up to date, you are not got any gestational diabetes cases.
So it's more hypertensive.
Hypertensive cases because the hypoproteinemia cases more, hypoproteinemia cases, and few cases of hypertension. Anemia is the main barrier for this pregnancy. So due to supplying of the hemodinics syrups, capsules, and we are giving costliest syrups we are giving. So for with that they are getting safe delivery and child also very healthy.
What's the average number of children that each family has?
3 to 4 minimum.
4.
Minimum.
He's been filming us this whole time. So there's one designated one in this group.
There are some government nominated CSWs. There are some government paid, some government paying some mean amount to them.
Stipend.
So the Sevabharathi CSWs, with that what we call as Arogya Mitras. Arogya Mitra we call it. We won't pay any single pie, but they are doing honorably they are doing service they are doing without taking any money.
How do you get them to buy into doing the service without taking money, especially in such an
Because
impoverished
they
region?
they are born here, and they have to they will be very happy to serve those companions. They feel like that they will serve. Suppose they will take some amount of rupees, even though they get more. They want getting more. So there is no final ending for these aspirations.
How do you identify the community health workers? How do you choose which person is going to receive the training?
Some people are they pass some 10th standard.
10th standard.
10th standard.
Okay. Yeah.
In some areas they get minimal education like 5th class like that. Few areas they know write, they know how to write, but they can't this thing. So in that way we will select. And main purpose of selection is they have to be here only. Then only they can serve. In emergency, suppose some community health worker stays in somewhere, what is the use? They can't come all the way from to here. So community health worker stays here only. Every Gudam we are planning. Till now we are having 20 Gudams. We are having some community health workers.
How close is the nearest medical facility?
Nearest medical facilities that depends upon the Gudam's. This Gudam, 35 kilometers, nearly 30 kilometers they have to go for getting PSC. Even go to Sri Salem or to Atmakur like that. You have seen the road.
Yes.
This will be a normal, natural facility for all the Gudams.
Okay.
Most of the people they get not good roads.
If someone has an emergency and they need to be transported, how are they transported?
They usually by emergency, but they go by here. They are not having bullock carts. In some areas, they are having bullock carts. So bullock carts they will go there. Here they have to walk and go. That's all. There is no other go. Some autos are there. They will call the autos and they will go.
Okay. What are the common menstrual hygiene practices among the women here? When they're menstruating, what do they do? Do they stay secluded? Do they use menstrual cloths or rags?
Here there is no such facility there. They are not yet planned. Their own traditional this thing having they are having cloths. I think. They will maintain the cloths. How regarding this hygiene and all these things we don't know. In particular, we are not focused in that way. and neither we are not supplying any sanitary pads. They are having their own traditional way of keeping the sanitary cloths with them.
Is it traditional practice for the women to be secluded during menstruation? In a lot of the rural regions of Nepal, they have a practice called chowpatty, where it is traditional for the women to be secluded, and usually that's outside, like in the goat shed or with the chickens, but they're not allowed contact with the rest of the family or food because they're considered unclean during that time.
Most of the learned areas they do practice like that only, but here because it is a tribal area, so not have gone into depth in this subject.
Is it a subject that's taboo, or has it just not been broached?
మీరు మాట్లాడుకుంటున్న సబ్జెక్టా లేదంటే మనం ఇంకా దానికి అప్రోచ్ కావాలి?
We are not approached. We are not approached because being a male doctor,
Yes.
there is a problem of communication.
Yeah. So if you had a female doctor on your team at some point, it would be appropriate
That will
then
be very
to
appropriate.
to talk about that.
ఎనీ డాక్టర్
Sometimes,
Yeah.
a few years back, we had a bitter experience to get examined because with a male doctor.
Uh-huh.
So we have taken one woman to this one nursing home in Kurnool, in nearest area, civilian area. So she's infertile. She's infertile. So she has to get the per-vaginal examination. Per-vaginal examination, she refused and came back. The examining doctor was only lady doctor, but that practice is not available to them, and they don't know how to. In that way they will.
They feel violated and scared because they don't understand
scared,
it.
The women are
Yeah.
scared and ran away. So this is the condition. They don't know the proper way of education. Sex education is not there.
Is the whole process of menstruation and when the girls are hitting puberty and their body is going through changes, is there a way that the information is communicated from one generation to the other? Is it like the mother that's the keeper of that knowledge and gives it? Is it an aunt? Is it a grandmother?
They will give their mothers. They will give the health education
To the daughters?
daughters. But that is their own tradition. In their own tradition, that we are not knowing. Okay.
What is the average age of girls? Do you know the average age when they start menstruating? I'm guessing young if they're having children. Young.
12 years,
12
11,
years.
12 years anarchy. Even before menarche also, sometimes they are getting married.
Even before.
Yes.
Do you think that further contributes to the infertility?
That surely,
Yeah, there are.
because proper nourishment will not be there, and proper cycles will not be regular. So they get vexed with the non-having the children, non-having children. Community health worker here in this Gudem, working since past 10 years. She's been associated with our organization regarding treating the tuberculosis cases here. There were 10 patients of tuberculosis here. We have given some nutritious food and regular monitoring of the TB drugs through the DOTS procedure. So these two are the people, CHWs, who are helpful to us for treating these cases.
What is.
మేము చెప్పండి సార్.
I am a community health worker from the United States. And I am interested to know what the most challenging thing is that you have to treat and that you have to face as a community health worker here in your village.
ఈమె కూడా మీలానే పనిచేస్తుంది. మీరు ఎట్లయితే ఆరోగ్య దానికి కార్యకర్త ట్రైనింగ్కి వెళ్ళి వచ్చారో అట్లా ఈమె కూడా వెళ్ళి వచ్చింది. కాకపోతే ఈమె అమెరికాలోను ఆఫ్రికాలోను వేరే దేశాల్లో మనకంటే ఇంకా ఏమంటారు పేదరికంలో ఉన్న దేశాల్లో చేస్తుంది. సో ఇక్కడ మీరు పనిచేస్తుంటే మీకు వచ్చే ఇబ్బందులు ఏంటివి, ఏమి కష్టమైన ఏమనిపిస్తుంది అని అడుగుతుంది. మీతో మాట్లాడేటప్పుడు కానీ ఇక్కడ సమస్యలు చెప్పేటప్పుడు కానీ మీరు ఎదురెదురుతుంటారు కదా, అవి ఏంటి అని అడుగుతుంది. ఆరోగ్యపరంగా
మాకు ఇబ్బంది అంటే సార్ మాకు రోడ్డు మార్గం మంచిగా లేదు. ఒక రోడ్డు మార్గం లేదు సార్. ఇంకా మాకు వచ్చపోనీకి బండ్లు కానీ అవి కూడా ఏం రావు. మేము ఏదన్నా ఇబ్బంది పడితే కూడా మేము మా ఊళ్ళు ఇంకా గర్భిణీ మంటలు సరే ఒక పేజెంట్ ఎవరైనా చాలా సీరియస్గా గినా మేము జోల కట్టుకొని రోల పంట తీసుకుపోతే రోల పంట కాంచి మెయిన్ రోడ్డుకి పోతే కాంచి ఆత్మకూరు తీసుకుపోతాం. 14 కిలోమీటర్లు ఉంటుంది సార్.
First and foremost problem is the motorable road. Anything that any small problem or the big problem, they have to travel 14 kilometers. This village called Rolapenta. It's 14 kilometers from here.
They carry the person jole kada kattu they carry on their backs.
Like the kid was hang there in a sari.
They carry with bamboo. They carry that person, ill person to this
in a much stronger cloth.
That road. So that way there is a lacking of roads here.
And what kind of sickness, when somebody is that sick, what do they have? What's going on with them when you decide to take them to the nearest health center?
దగ్గరలో ఉన్న హాస్పిటల్ తీసుకెళ్తున్నప్పుడు వాళ్ళు జనరల్గా ఎట్లుంటారు అంటే బాగా బాధపడుతుంటారు కదా ఏదైనా సమస్య వచ్చినప్పుడు, జ్వరం కావచ్చు లేదంటే ఇంకేదైనా.
ఇంకా మన గవర్నమెంట్ డాక్టర్లు కాకపోతాం సార్ మేము.
గవర్నమెంట్ డాక్టర్
పోయినా చూసుకుంటారు.
ఈ 14 కిలోమీటర్లు
పోవాల్సిందే సార్.
So they have to go all the 14 kilometers, and whatever small or big ailment they have to okay whatever small or big ailment they have to walk these 14 kilometers, carry the patient on their backs. So it's just that.
What is the most common ailment in the village?
మామూలుగా వచ్చే సమస్య ఏంది?
ఎక్కువ వ్యాధులు ఏమొస్తున్నాయి ఇక్కడ?
మామూలుగా వచ్చేది టీపాది ఎక్కువ, టైఫాయిడ్ జ్వరము, మలేరియా జ్వరము ఇవి ఎక్కువ వస్తాయి సార్.
మలేరియా, టైఫాయిడ్, టీబీ.
In children they get pneumonitis also.
And how are you able to treat the malaria?
మలేరియాకి ఎట్లా చేస్తారు మరి?
మలేరియా ఇంకా ఎక్కువ వస్తే ఇంకా హాస్పిటల్ తీసుకుపోతాం సార్. ఇంకా హాస్పిటల్ చూపిస్తాం. మా అక్కడ ఉండేది వాళ్ళు ఇచ్చేది జ్వరం మాత్రం ఒకటి, ఇంకా బేది మాత్ర ఒక ఒళ్ళు నొప్పులు మాత్రం ఓఆర్ఎస్ ప్యాకెట్ ఒకటి అవి ఇస్తారు మాకు. అయితే తగ్గకుంటే మా దగ్గర మాత్రలు ఇస్తాము. ఇంకా మేము తగ్గలేదు మీరు హాస్పిటల్కి పోండి అని చెప్తే ఇంకా హాస్పిటల్కి చూపించుకొని వస్తారు సార్.
Normally they would have small fever tablets or whatever first aid and immediate kind of drugs, life saving first aid drugs, and if that is not solved then they would go to the doctor.
In this area, is malaria, it's obviously endemic if it's still here, but is it any kind of chloroquine or mefloquine resistant here?
Chloroquine resistance malaria is not here. Few cases are there. Most of them are Plasmodium vivax is seen. Plasmodium falciparum cases are seen very less because plasma the chloroquine pro-chloroquine is there.
So chloroquine then is the most common form of treatment for malaria?
Yes, chloroquine we are giving here.
Chloroquine.
And Trianum too, like followed by one tablet after 6 hours, 24 hours after 24 hours one tablet, after 24 hours one tablet like that we are giving. So previously they were also provided that, but in these days they are not giving.
Okay. Is there malaria preventative that happens in the village? Are people sleeping under bed nets? Are they using the smoke from their fires to help keep bugs away? Is that the main form of prevention?
దోమలు రాకుండా మీరు మీ దగ్గర ఏం చేస్తున్నారు అంటే ఇది మన దోమతెరలు వాడుతున్నారా లేకపోతే ఏమైనా పొగ పెట్టుకుంటున్నారా ఇలా ఏం చేస్తారు మీరు?
పొగ పెట్టుకుంటారు, ఇండ్లలో పొగ పెట్టుకుంటారు సార్. ఇంకా దోమతాలు కూడా కట్టుకుంటారు. మన ఐడిడిఓలు ఇచ్చినారు కదా, ఆ దోమతాలు ఉండవి అవి కట్టుకుంటారు. ఇంకా ఎక్కువ చీకటి వెళ్ళేది ఇంకా ఇంట్లోనే పొగ పెట్టుకుంటారు సార్.
So they use both. Normally the ITDA they supply a little bit of mosquito nets, and the rest of them they get back to the normal traditional practice of smoke and everything.
How is malaria diagnosed in the village, or is it, or do you have to wait till you get to the health clinic to do a slide looking for the plasmodium?
Usually we take critical history first, and we start empirically, and prior to that we get any doubt, we'll get smear and send to the nearest PSC. Nearest PSC they are doing the malaria test done. So we take smears only here.
Okay. How are the smears transported?
They will be transported in boxes and kept.
Regular, the old slide boxes, the
Yes.
old-fashioned slide boxes. Okay. Okay. What else? Typhoid.
నువ్వు చెప్పిన మూడు జబ్బులు కాకుండా మలేరియా, టీబీ, టైఫాయిడ్ చెప్పావు కదా, అవి కాకుండా ఇంకేముంటాయి? మలేరియా, టైఫాయిడ్, టీబీ చెప్పావు కదమ్మా, ఈ మూడు కాకుండా ఇంకేం వస్తాయి జనరల్గా మన గూడెంలో?
దగ్గు పరసలు వస్తాయి సార్. పరసము,
దగ్గు.
దగ్గు అదే సార్. జ్వరం వచ్చినప్పుడు ఇంకా దాంట్లోనే పరసం అనేది జలుబు చేసేది అంతా ఇంకా జ్వరం తేటే వస్తుంది సార్. ఇంకా అది.
So apart from this malaria and TB and all these things, they get recurrent colds, recurrent fevers, diarrhea, like that. She's telling.
What is there a traditional remedy for the diarrheal diseases and for dehydration? How do you combat dehydration once that's set in at the village level?
సో మనకు బేదలు అయినప్పుడు నీళ్ళు ఎక్కువ పోతుంది కదా, అప్పుడు ద్రావకం మనం ఏమైనా ఇస్తామా, పొడులు ఏమైనా ఇస్తామా, ఏం చేస్తారు మీరు? అట్లా
కొద్దిగా చక్కెర అన్న కలుపుతాం. చక్కెర కలిపి ఉప్పు కొద్దిగా కలిపి తాపుతాం. ఒకవేళ అంత చక్కెర కలిపి నిమ్మ తాపుతాం సార్.
They do the same thing that you did last year.
ORS. Okay.
If there's no ORS, they make it like with salt, sugar.
Locally they
right
prepare
mixture.
because they don't get instant powders like that. They prepare them.
ఇంకా ఎక్కువ అయినప్పుడు ఇంకా కట్టం తాపుతాం. ఇంకా
మనకి విరేచనాలు ఎక్కువైనా మనకు పిల్లలకి కానీ పెద్దలకి కానీ నీరు మేమడి చెక్క తెచ్చుకొని మజ్జిగలు తాగుతాం.